Your time is getting over, everybody. Just 10 seconds more. All right, your time is over, everybody. Please stop looking for the answer now. Let's find out the answers. The purpose of this session is to teach you how to find out the answers. According to the first paragraph, Miss Adrian could not carry on with the treatment options for long. Miss Adrian has been able to maintain consistency in trying treatment for her condition. Miss Adrian commenced treatment after many years since she was diagnosed with PCOS. Oral contraceptive pills could achieve a lasting solution for all her problems for a while. For all her problems for a while. When I read this one, what I find is all her problems were not solved with the contraceptive pills here. All okay. Even if it was only for a while. Where is it mentioned that all her problems were with the use of oral contraceptive pills? She experienced an improvement in her menstrual cycles, although here, she continued to have mood swings, irritability, and severe headaches. So, look at the D. Oral contraceptive pills could achieve a lasting solution for all her problems for a while. It is neither for a while nor for all her conditions, all her problems. So, eliminating one of them. We are eliminating one of them. Now, which one will you eliminate next? Can somebody please suggest which one are you going to? Which one? C.
C, sir.
Miss Adrian commenced treatment after many years. After many years, see, saying that many years. So we have to find out since she was diagnosed with the PCOS. When was she diagnosed with the PCOS? Can somebody tell me? She was diagnosed with the PCOS in which year? Okay, Miss Adrian had a 26-year history of PCOS characterized by. So this is somewhere like a 26-year-old history of PCOS was there. Now, after this one, characterized by all these things are mentioned here. 20 years ago, her
20 years ago, yeah.
yeah, 20, that 26 years and then 20 years. There's a gap of almost 6 years of gap is there. So how can we say that Miss Adrian commenced treatment after many years since she was diagnosed with the PCOS? 6 years, is it a many years, something like many years? 6 years is not
No.
very small, not very big.
Yeah.
So how can we see that Miss Adrian commenced treatment after many years since she was diagnosed with the PCOS? Can anybody show me any area where she started her treatment exactly? 20 years ago, her gynecologist suggested lifestyle changes. Can you find, please, anybody? This shows, one second, please. Okay, this shows that the C, Miss Adrian commenced treatment after many years since she was diagnosed with the PCOS. Where is it mentioned that she commenced treatment? I'm talking about a treatment here. 20 years ago, her gynecologist suggested lifestyle changes such as exercises, nutritional guidance, low doses of oral contraceptive pills. Okay, while exercises is not exactly treatment, nutritional guidance is also not directly treatment. Low doses of oral contraceptive pills, they are treatment. Cosmetic surgery, sorry, cosmetic therapy and laser therapy for what is this? Hirsutism, right? Hirsutism, okay. It is something about having hair on the face of females, basically, okay. So because of the high level of hormones like what is that, like androgen hormones, like okay, the male hormones. Fine. So that is about this condition called hirsutism, okay, or hirsutism. Fine. Now, where is in this area mentioned that she commenced treatment? Did she commence treatment? Yeah, there is a mention that contraceptive pills, but it is only suggested by her gynecologist. Does it mean that she started? Yeah, of course, because here the gynecologist suggested, but it doesn't mean that she started or not. But the next sentence says, with the use of oral contraceptive pills, that means she started oral contraceptive pills. So again, the problem is coming here, the C1. Miss Adrian commenced treatment after many years since she was diagnosed with PCOS. So my question is 6 years many years? That is my question. Yeah, I think most of you will agree that this can be a correct answer. Fine, let's keep it in the showcase for a while and let's see whether there is any better answer for that. So we are going to, so I think just now you said that we can easily eliminate it completely. Do you have any reasons supporting that?
Yes, sir. I'm eliminated the C option because after many years also one cause and also Adrian commenced the treatment
Okay.
because gynecologist suggested
Okay.
the options, treatment options.
Okay.
That's why.
Okay. So there is a suggestion was done, but we do not know when she started taking the medicines. Probably she started immediately after that. Definitely, looking at the character of this patient, she would have started because she tried a different kind of treatment she started. So definitely she wouldn't delay that. So there is a chance for C as the correct answer. But anyway, let's go to any other answer which is stronger than C. So if there is a stronger one, we will have to eliminate C. Miss Adrian has been able to maintain consistency in trying treatment for her condition. Do you think she was consistent? It shows that she discontinued all contraceptive pills after a few months of use. See, if a patient is consistent, she would stop after many years, but she stopped oral contraceptives pills after a few months of use. That is very clear indication that means it is totally incorrect here. She did not maintain any consistency here. Now we have got A and C as the possible correct answers. Miss Adrian could not carry on with the treatment options for long. Miss Adrian could not carry on with the treatment options for long. Very clear, she could not carry on with the treatment options. But we are looking at one more thing. Which are the treatment options here? In this one, oral contraceptive pills are the only treatment options mentioned here. She experienced, see, look at this one. Okay. Can anybody find any other treatment option other than oral contraceptive pills? Even after this also, several oral contraceptive pills she tried, means the dosage was increased, but all showed severe side effects. So can we think that A is the right one? Miss Adrian could not carry on with the treatment options for long. Yeah, definitely this answer also is correct. Now we have got two problems here. A and C are equally correct. Anybody here to say that you agree with one of them over the other one? Can please anybody come forward? Which one do you still like? A or C?
Yes, sir.
A will be, yeah, A is clear, very clear. Miss Adrian commenced treatment after many years. Many, the number of many is, many is always more than 50%. So since there are 26 years here, 26 years, so something like 13 will be the half of 26 years. So many years must be like a few years, see, a few years, some years, since the span of her treatment is 26 years, or since the time after her diagnosis is 26 years, we cannot call it exactly many years. Many will be a confusion here, although this answer can be like a 60% correct answer, whereas you have to go with this one, which is a 100% correct answer. Did you understand the reason why we are going with A rather than C, all of you? I think you have understood that. Anybody else having any confusion, any argument, please come forward. And also remember, everybody these days, those who have written the OET examinations, they complained that the biggest problem they are finding is reading. And in reading, the biggest problem they are finding is two answers seem to be the correct answers. For example, A and C appear to be the correct answer. How did we eliminate C over A? We applied the number method. I hope everybody knows what is number method. So there are almost 200 words in English language that have some kind of number. So after many years, many always comes like it is 6 out of 10 is this one. If it is like some years is something like it is some years is usually like this is it. And if it is a few years, if you're talking about a few years becomes like a 3 out of 10. And few years is 0.5 out of few means 0.5. So many of you do not know what is the number method here. So please understand the number method. A lot of things will happen. Rather than spending your whole day completing a sample paper, okay, under the guidance of a clock or a watch, please stop doing such things. This is the reason why you fail in OET reading and listening. Please understand that. All right. So we have to move to the next one. Anybody having any objection to me? Please come forward with your objection. You can. Anybody still doesn't totally agree with me? Come on. Otherwise, we are moving because we have very limited time. Mrs. Adrian stopped the use of oral contraceptive pills because they had no effect on her conditions. I'm eliminating this one because no effect is completely incorrect because she had a certain effect on that, especially with the use of oral contraceptive pills. She experienced an improvement in her menstrual cycles. So this is not equal to a no. So I'm eliminating the first one. A is being eliminated, correct? Now, they had more side effects than expected. She had not expected anything here. No expectations are mentioned here. We are eliminating B also. They had more cons than pros. They had more cons. Cons, you know what is cons? Negative side. Side effects, okay? Than pros. Pros means the positive side. Can you find something like that? They had more cons than pros. The only pros will be here. Look at this one. I can show you here how to find out that one. Look at this. I'll show you which are the pros and cons here. Look at this one. They had cons. Which are the cons and which are the pros here? One of the pros here is this one was one. What was it? Experienced an improvement in the menstrual cycles. That is a pros. And which are the cons? Okay, although she continued to have, okay,
Mood swings,
yeah, she
irritability,
had mood swings, she had irritability, she
severe
had
headache.
severe headaches. Three and one. Pros, only one pros is there. So look at the C once again. They had more cons than pros. Is it the reason? They had more cons than pros. You may be tricked here by OET also. I'm going to trick you. I'm sure you are going to commit a mistake. All of you are going to commit a mistake. You know what's the mistake? The question is, Miss Adrian stopped the use of oral contraceptive pills because they had they had more cons than pros. Okay, the pros part, that means the advantage part was because of that. So can you say that she developed headaches, severe headaches, irritability, mood swings because of the oral contraceptive pills, or these conditions existed even before that? Come on, come on. See, my question is, Miss Adrian stopped the use of oral contraceptive pills. Can anybody say that her three problems, which are they? This one, mood swings. Okay, number one, irritability. Number two, severe headaches. Where is it mentioned that these things developed because of the oral contraceptive pills? Using oral contraceptive pills, she could have some effect on her menstrual cycles were improved. That's it. So can anybody say that her mood swings started or continued, or irritability started and continued, severe headaches developed because of the oral contraceptive pills? Some of you are confused, right? Come on, please somebody answer here. Can somebody answer? Miss Adrian
Sir,
stop.
then
Yeah.
next line, she was switched to several oral contraceptive pills,
Mhm.
but all showed severe side effects.
Okay, they all had a severe.
Yeah.
Are these side effects same as these ones? Like severe headaches was a side effect, mood swings was a side effect, or irritability was a side effect. Actually, these conditions already existed. Don't you think so? A person who has got PCOS is supposed to have all these problems, including menstrual cycles, the irregularities. After taking the oral contraceptive pills, this improved, but these remained the same. Okay, if Jasna says that mood swings, irritability, and severe headaches developed after taking the oral contraceptive pills, then I will agree with you. But there is no mention that mood swings, irritability, and severe headaches were because of oral contraceptive pills. So look at this once again. Miss Adrian stopped the use of oral contraceptive pills because they had more cons than pros. So they had oral contraceptives had more cons than pros. It was not because of that. It was not because of that. Because she could only improve the menstrual cycle area was improved, but this she continued to have. See, look at this one. Does it say that she developed? She continued to have means, see, like I wrote OET 3 times. After all, and then I went for the 4th time. I continued to have the same result score in reading. I continued to have means Jasna and others. I continued to have means even before writing the 4th one, my reading score was 280 to 90. I continue to have. Similarly, these conditions, these 3 conditions, mood swings, irritability, and severe headaches, already existed. They were pre-existing conditions, and we cannot connect that these were the side effects of that. That's the reason continued is there. I hope it is
Okay.
clear to you, right?
Yes.
Okay, fine. Okay, thank you. So this one they had more cons than pros. This also is being eliminated. If anybody didn't understand, please ask me. You can ask me privately too. So don't worry about asking. They could do very little to ease her distress. Very little, very little. So I'll show you the difference between little, the number of little. Little means everybody knows little is equal to 0 out of 5, 0.5 out of 10. A little is like 3 out of 10. And then we have other numbers. Okay, then very little. What is the meaning of a little and very little is equal to? Very little is equal to something less than a little. Very little. Okay, so if a little is 3 out of 10, very little must be something similar to this one. Okay, so now looking at all these things together, she had only one good effect of that. What was that? She could manage her menstrual cycles were managed. Whereas 1, 2, 3 problems continue to be there. So they could do little, they means what? Oral contraceptives could do very little to ease her distress. Her distress continued to be there. And what were her distress? Mood swings, irritability, severe headaches. And they could do a very little to ease. And what is a very little thing here? That is an improvement in her menstrual cycles. So this answer will be the right answer. May I know how many of you got both these answers correct? Will you please raise your hand? Those who got both these answers, please raise your hands. All right, so don't worry. So whenever you do some reading, what happens? You feel a bit depressed after each time of your reading. No problem. The only solution for all your reading is this one. You have to attend discussions. Wherever you find discussions, any person conducting a discussion on reading, please attend that one. That is the only way to improve your reading and even listening things. So we are moving to the second one. Please find out your answers. Please complete fast. There is a bit of modification in the answer number D, option number D. Your time is going to be over. All of you, your time is going to be over. There are only 2 questions. Please complete. Those who have completed, please raise your hands. I can see 18 out of 31 of you have done. Your time is just getting over. Just 30 seconds more. Please complete fast. All right. So your time is over. Before we go to the answers, I have a small question to all of you. Can you please, all of you, please put your hands down? Now tell me, how many of you in this class are having reading as the highest challenge? Please raise your hands. For whom reading is the biggest problem, please raise your hands. There is a button to raise your hands. On Zoom app, there is a button to raise your hands. Reading as the biggest challenge, please raise your hands. Only 10 I can see, 11 out of 32. Please, everybody. Okay, I can see 19 out of 32 are having reading as their biggest challenge. 20, okay. Please, if anybody here, please raise your hands. There are 32 people here. And how many of you, listening is the biggest problem? Please put your hands down, others. And only listening problem people will raise their hands now. Only, I'm talking about listening. You can forget the reading part. Listening, I just want only listening. There are 14 people who have problem out of 32. No, there are 15. Yeah, a total of, how many of you have writing as the biggest problem? Please tell me. Please raise your hands. Writing. Others, please put your hands down. Writing is your biggest problem. See, the number of people who have problems with the writing is very, very limited now. Only 4 people are having the problem with the writing. So they can join my class at 10:30. Okay, so others, now everybody please put your hands down. The last one, how many of you find speaking as your biggest challenge? Speaking as the biggest challenge, please raise your hands. Like you cannot speak, you don't get ideas while speaking, you commit mistakes, you repeatedly fail in speaking, you don't know how to deal with a warm-up question, such problems, how many of you? Okay, there are 11 out of 32 here who have this problem. Going back to writing, you know that for most of the countries, for especially for UK, you need only 300 marks for writing. At the same time, if you can score very high mark, it can also be a beneficial for all of you if you can. Okay, so like you said that writing is not a problem for you, but my question is about writing once again. Like how many of you in this class get the 320 in your mock test? I mean, whenever you are, suppose you are in a, you are studying from another institute or you have a personal trainer with us. So those, how many of you are getting 320? Please raise your hands. Those who are not able to get at least 320, please raise your hands. Those who are not able to reach 320 consistently, please raise your hands. 320. Only 7 people are having that problem. So we can say that writing and speaking are not a real problem these days, but reading and listening are the biggest problems. Fine. And that is why we are all here. Now it's time for us to discuss this one. Commencing on escitalopram. Okay, that is a medicine for Miss Adrian. Okay, for treating her PCOS combined with MDD. Okay, fine. Right. Now, going to this one, commencing on escitalopram, so unremarkable improvement. So it says that it was not unremarkable, it was definitely a remarkable improvement was there. There was remarkable improvement. So we cannot call it unremarkable improvement. Where is it mentioned that she had a remarkable improvement? What was the effect of? After 4 weeks of treatment, she experienced clinically significant depressive symptomatic relief. Remission. See, another one. Remission was achieved in 8 weeks. What is meaning remission? I hope you know the meaning of remission. You should understand the meaning of remission because it is used in reading and the listening also. Remission. Remission is the situation, a condition when the symptoms of a particular disease, especially cancer, disappears almost forever. This doesn't mean that the condition is cured, but the condition is not, what do you say, manifesting or, yeah, they are not visible. So that means you can say that the patient is almost cured, but it is not a real cure. That is called a remission. Remission is somewhat equal to cure. Oh, fine, you got it. Now, commencing on escitalopram, so unremarkable improvement is completely incorrect because it really gave her a lot of improvement. So great improvement in Miss Adrian's overall condition. So can we say, okay, she had improvement. We agree with that. She really had improvement. But can we call it a great improvement? Yeah. Remission itself is happening, and that is not something small. It is great improvement. Okay, that is also done. Then what about this one overall condition? Like earlier in the previous paragraphs, we saw that her menstrual, cycles, that problem was solved, but other problems continue to be there. So can we say overall condition, can we say all her problems were almost affected because of this one? Yeah, I think she continued to receive escitalopram and experienced a return of regular menstrual cycles that also improved and improvement in her hirsutism. She reported transient mild nausea. This is the only negative part here. Transient mild nausea at the beginning of treatment, no other side effects were. That is only the beginning of this one. At the end of this one, she had a great improvement. We can say overall condition can be correct. But before concluding anything, you should not be in a hurry. Can we say it deteriorated her health for a few months? Nowhere it is mentioned. It is not mentioned. Ended up in increasing its dosage infinitely. No, even that is also not mentioned. So how many of you thought that B was the correct answer? Will you please raise your hands?
B, sir.
Those supported B, please raise your hands. I'm expecting at least 25 of you. 25 out of 35.
Yeah.
But only 15 have raised the hands. 17. What happened? I think some of you really want to ask me a question. Like those who still don't agree with that, please ask me. If you have no question, it means you agree with my explanation. All right. So please understand what you have to do every day is discussions. So never miss discussion opportunities. When did Miss Adrian get the highest amount of relief from escitalopram? At the start of the treatment? No. At the start of the treatment, she had some mild nausea at the beginning of the treatment. So there was no. So at the start of the treatment is definitely incorrect. We are eliminating that. And after 4 weeks of treatment, did she achieve the highest one? Can we say? It is not possible to say that way also. In the 8th week, what happened in the 8th week? In the 8th week, okay, remission was achieved in 8 weeks. Okay, it's something closer, but was remission the highest level of achievement? Did she achieve anything more than remission after that? Yes, that is it also there. So that is only the remission happened there. So this also cannot be included in the answer. Over the 18 months after the initial 8 weeks will be the correct answer here. All right. So this will be the correct answer. This much we have done. Now, how many of you had supported D? Please raise your hands. How many of you thought D was the correct one? Please raise your hands. I'm not expecting too many, but less than 20 will raise the hands now. What happened? Some people are not raising the hands at all. You don't have to raise your real hand, please. There is a button on Zoom in the reactions area. Go there, find a hand button, just touch that. You'll be able to raise the hand here. I will be able to see it. Your hand has raised here. Okay, fine. So 80 out of 35 of you have got it. So please understand this one. It's time for us to go to the listening that we had discussed yesterday. It won't take much time, just 10 minutes. Okay. So some of you are, getting, what you're feeling like you want to leave this class and go to your daily routine. What is that? You'll be going to your daily routine kind of sample papers. So sample papers, the benefit you can get from sample papers by repeating the sample papers. Did you understand what I said now? Those who are going for sample papers, like for example here, there is Anusha. Okay, Anusha is going to do a sample paper. Yes, that is completely fine. She can do, but she has to see she does that sample paper in 1 hour. Okay, after that, what is she going to do? She'll be going to the answer keys. Answer keys are the biggest problems. I have been telling this for the last 4 years. Answer keys are having a lot of mistakes. Most of the answer keys that you are having contain 20% errors, and you are going to depend on that. That is a problem here. That is a problem. Depending on the incorrect answer keys will be a big problem for all of you. All right. So please make sure that your answer keys are correct. And then after this, please don't go to the answer keys. Step number 1, you go to the take the test. Take test. Step number 1. All of you, please follow my instructions. Take 1 hour. After this one, you shouldn't go to the answer keys. And if some answers are not done, repeat it. After repeating, go to the answer keys. So the repetition is the most important one. And how to do the repetition? You can use Google. Use the Google. See the meanings of words, every word. And only after that, you'll be going to the answer keys. So those whoever in this class is doing this mistake is going to write OET more than 10 times. And what is that mistake? The mistake is this one. This is the wrong way. And what is the right way? The second is the right way. This is the right way. That means take test in 1 hour and don't go to the answer keys. Repeat it using dictionary and other things, and then go to the answer keys. This is the best way. So please, everybody, follow these instructions. Very important instructions. All right. Today is the result day, and everybody is waiting for the result. If you are waiting for the result, remember one thing, this time the exam was not very easy. So if you are a beginner, if you wrote the exam for the first time and waiting for the result today, please don't expect too much. Please accept the reality. If you are starting with OET, some of you will have to write OET 3 times, some of you have to write 2 times, some of you have to write just 1 time. That is just because of their luck and their education qualifications and their brain skills. All right. So now it is time for us to go to the listening part. Stay with me for 10 more minutes. Here we go to the listening. These were the questions that we discussed yesterday. Now you can also see the original transcript of the same. That will also help you to finalize your answers. Please go through this one now.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear.
One second. If you are good at listening, please leave the class. If your score in listening is always 35 plus, you can leave this class. You don't have to join this. You don't have to continue this class. But if your score is not always more than 35 or 33, you have to stay in this class. Okay, please continue here.
You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a doctor talking to a nurse regarding the discharge of a patient. Now read the question.
Hi, Dr. Bless. I wanted to talk about Mr. Johnson in room 302. Considering his progress, I think we should plan for a discharge by the end of this week. What are your thoughts on that? And is there anything specific we need to address medically before finalizing the plan?
Thanks for reaching out. I agree. Mr. Johnson has been improving. Before discharge, let's order a final round of blood tests to ensure everything looks good. Also, I suggest scheduling a follow-up at the outpatient clinic within a week post discharge. What do you think? And do you have any other concerns?
That sounds like a solid plan. I'll get the blood tests ordered and coordinate the outpatient follow-up. Anything else we should include in the discharge plan? And do you have specific instructions for Mr. Johnson upon leaving?
Make sure to provide him with details on his medication schedule, any dietary restrictions, and signs or symptoms to watch out for after discharge. And of course, the outpatient clinic should have all the necessary records. Let me know if you need anything else.
Perfect. I'll ensure all those details are covered. Thanks for your input, Dr. Bless. I'll keep you updated on the program.
Great. I appreciate your proactive approach. If anything comes up or if you need further clarification, feel free to reach out.
Let's now come to this one. According to Dr. Bless, Mr. Johnson's prognosis is not good. So the answer will be Mr. Johnson has made some remarkable recovery is the correct one. So this was already discussed yesterday. So this is the correct answer. Those who wrote C, they will be getting the score here. Remarkable recovery is the correct one. Going to 25.2, you will find the nurse's initial plan for Mr. Johnson was to discharge him before the next week. Before the next week, those who wrote this answer got the answer. The score for that. I'm discussing this because we had discussed this one already yesterday. That's the reason. What does the doctor intend to do before the discharge? Blood test is a correct answer here. And 25.4 is when does the doctor think the patient should visit the outpatient clinic? Okay, within a week after discharge. And then there is another one, Mr. Johnson may need to refrain from eating certain foods. Maybe some of you wrote increase the volume of food. That is not correct. Refrain from is the correct one. Include certain types of food, since that is not mentioned anywhere. Only talking, it is only saying about limiting or restrictions are mentioned here. What do you mean by restrictions? Yeah, dietary restrictions are there. Restriction is not eating something new. It is stopping something that you have already been eating. So going to the next one. Like here 24th 25.5, then the last one is this one. Answer is C. The doctor thinks that Mr. Johnson would develop postoperative trauma is not mentioned. Poor compliance with the postoperative medication is not mentioned here. Postoperative complications are there. Yeah, compliance is okay, but this is not mentioned anywhere. Postoperative complications are there. If you didn't understand how and where that answer is there, you can see here. And signs or symptoms to watch out for after discharge. Signs and symptoms of symptoms. That means signs of a complication, symptoms of a complication. So the answer will be C will be the correct answer for that. So based on yesterday's test, how many of you got all of them correct? Will you please raise your hands? Those who got full mark in all these 25.1 to 25.6. Anybody got full mark? Okay. Yeah, okay. Anyway, I have received your submissions. The winner will be declared today. But the problem is nobody's answer was 100% correct. If you wrote these answers correctly, and if you had submitted your answers in time, please contact me. You will be the winner of yesterday's contest, okay? And there is a listening, but we are not going to the other part of the listening part. We are winding up this session because we have to start the writing shortly after this. So, anybody having any question, please ask me. Otherwise, we are winding up the first session of today. Anybody, any question? I think nobody has a question. All right. So see you then in the writing class. Those who have serious problems with the writing and also beginners and those who are not able to reach 320 in writing, all should join the class at 10:30. And remember, those who have not paid, they can continue to attend 10 classes, a total of 10 classes. After the 10 classes have been reached, you are not supposed to continue the classes. Okay, see you then. Bye.
Thank you, sir.
All right.
Thank you, sir.
Okay.